All right, folks, so right now with Dr. Darien, taking a look at some of the questions that our viewers are asking. And here is one. What tests can detect PCOS? That's from Mary Catherine. What is PCOS?
Yeah, great question. So PCOS stands for polycystic ovarian syndrome, a relatively common syndrome that is caused by a hormone disruption that leads to enlargement of the ovaries. And that hormone is often androgens or testosterone-like hormones that can lead to baldness or loss of hair, weight gain, acne, and a variety of other symptoms. So how do you get diagnosed? The first thing you want to do is talk to your doctor and get a physical exam to rule out the other possibilities. But a diagnosis of PCOS often involves blood tests, a test for hormones like those androgens or testosterone-like hormones, an ultrasound to look at the ovaries, and possibly other tests to identify the common causes of PCOS. And then the treatment can include a variety of things. Sometimes hormone medications like oral contraceptives, which can counteract the hormones in PCOS, and other medications that can treat your symptoms.
I have so many friends. This can be such a complicated, long journey.
It can be, and so many live without a diagnosis. So I think it's so important that if you have symptoms of hair loss, weight gain, acne, these symptoms that are associated with excess testosterone, that you talk to your doctor and you get tested.
Good to know. Your prescription for wellness.
We're talking about tension headaches. This is just it helps me to talk about these things because recently I was in the emergency room explaining what a tension headache is. It often feels like a tight banding-like pressure around your head, and then talking about ways to treat before you go to the emergency room, hopefully saving everyone a trip. So what do you need to do? So we're going to start with temperature therapy. It can be hot or cold, whatever feels most comfortable that can relieve the tension and hopefully subside your tension headache before it gets worse. And then next, you can reach for over-the-counter medications like ibuprofen, the active ingredient in Advil, acetaminophen, the active ingredient in Tylenol. You want to talk to your doctor before you take these medications, of course, but they can often be used together. And I found it can be really helpful for patients. And then alternative medication or alternative treatments like acupuncture has been shown to relieve tension, and even massages focusing on the shoulders and the neck can relieve that tension and help that headache subside. And then talk to your doctor about prescription medications if these don't work. Certain medications like triptans and other medications can be used to help reduce the tension headache, but also reduce the frequency or how often they happen.
So how do you know if it's dehydration?
Yeah, you know, that's a part of the examination. That can come with a headache, and it's an important reminder, DeMarco, we probably should start with drinking water. That is one of those things that I think are really important, and many people probably are dehydrated and don't even know it.
You see how carefully he was paying attention. He has a really bad headache today.
A really bad headache.
Oh, God. All right. Well, we'll talk about these treatments
Doctor,
after.
please. Doc, thank you. We appreciate it.
Of course.
And folks, we would love to hear from you. So please hit us up on Instagram with all of your medical questions at ABCGMA3. And I want it for free. Don't use my insurance costs.
I'll send you the bill out.